on the News Channel 5 network. This is MorningLine.
Good morning, everyone. Thanks for joining us on MorningLine. Nick Barris here with you. And we're going to shift gears again. After a whole week and one day of the Vanderbilt rape trial, we're done, and we're shifting gears to a new topic, albeit a heavy topic and an important one that I think is a major issue all across the country. But here in Tennessee, the problem with opioid addictions and the issues that go with it, and pain management and pain clinics, all of that. And I know many of you sitting at home probably take pain pills for a variety of issues, and the question is, do you end up becoming addicted to it, and what kind of help is out there, and is anything going to change? Because it seems like it's been going on without much of a change, and it gets worse every year. I was looking at some of the numbers over just the past couple of years here in the state of Tennessee, and some are calling it epidemic proportions, the degree of addiction and some of the overdose deaths. So we're going to get into that this morning with our guest from over at Vanderbilt University, Dr. Tracy Jackson. Good morning to you.
Hi, thanks for having me.
Nice to have you on. It is a big topic, and it's one that has been around for a while, and it just keeps getting worse.
Well, if you think about someone with chronic pain, it's a terrible, brutal affliction to have chronic pain every day.
Yeah.
And so if you do, people will do anything really to make it stop.
Sure.
It's the number one reason people go see doctors. It's the number one reason people are out of work. And the options that are given to control this pain are typically things that are like pills and procedures. In our system.
Meaning that you're taking a pill that's not curing what's causing the pain, it's masking the symptom, right? Or is it curing it?
No, I think it depends. Not all pain is created equal, and that's part of the issue. Some people have pain after they break a bone and it resolves. Some people have pain after childbirth and it resolves. But pain that becomes chronic over and over tends to affect everything about the patient's physiology. So the brain and spinal cord become sensitized to the pain, and because the pain and mood and sleep pathways are all the same in the brain and spinal cord, they all become affected.
Right.
So it can become a disease in its own right. And so there are some pills that try to address that underlying disease, but some pills like opioids are not doing a whole lot for that.
For whatever reason, too, humans love opioids. The brain loves it. Am I right? I mean, it hits you. And you've told me before we sat down, some people have different reactions than others. But it seems like it just grabbed, opioids. Can animals become addicted to opioids?
Well, that I don't know.
Okay,
but,
I was just wondering, but clearly humans can.
But I will say, I mean, there certainly have been studies in animals of opioid addiction, so I think that's true. And the point is, it's very highly evolutionarily conserved. Our internal opioid system is what protects us in times of fight or flight, or when we get injured, the opioids will naturally kick in. The issue is when you take opioids from the outside, it changes the way that your body's natural opioid production will work.
So we do have natural opioid production.
Yes, we have natural opioid production in our bodies.
Trying to minimize pain that you may be feeling at that moment.
Exactly.
Okay, so then when you're taking an external one, that it's just boosting it beyond what your body's normally used to.
Exactly. And in many cases, what people don't realize is that in the scientific literature, there's never been any real strong evidence that opioids work for chronic pain after about 6 months. They're great if you have surgery, they're great if you have cancer, they're great if you break a bone, but if you take them over and over daily, they tend to mess with your body's natural pain processing system such that you even have the capacity to feel more pain, and it messes with your immune function, your sexual function, your sleep.
Can it affect your hearing also? Wasn't there something like that? No, seriously, some of the senses and stuff. With certain addictions to some of these pain pills, you have all kinds of odd symptoms that people have if they've been on them for a sustained amount of time.
Yeah, and part of the problem is that if you look at any medication that you get, there's a list of
side effects.
100 side effects that you could possibly have. The other thing is that the average American takes 13 prescriptions a year. And so when you're looking at all the potential side effects of opioids mixed with all the other medications, we're in a situation where it's very dangerous as well often to take these medications combined with other drugs.
If you had a situation where someone prescribed, I'm just thinking viewers out there thinking, gosh, pills are scary like this when you hear what we're talking about this morning. If you're prescribed, say for a back injury, a 30-day supply of a painkiller, an opioid, okay, and you need it, should you take it?
Yes, I mean, I think opioids can be safe when taken as prescribed, and I was on the committee that drafted the opioid prescribing guidelines for the state of Tennessee, and I think the purpose is to allow us to continue safely prescribing opioids in patients who need them. And you shouldn't be fearful of that if taken as prescribed, but the expectation should be that they are short-term management options.
All right, so I mean, within 30 days sphere, or could it go longer? I mean, at what point, if you continually take these pills, and I guess it varies person to person, can you become addicted? How quickly can it happen?
So addiction can happen quite quickly. People will tell you. However, I think being aware of it is some of the first step, and having alternatives to opioid management strategies is really what is key. And that's, as a chronic pain doctor, what's frustrating to me is I don't think, and to my patients, is I don't think you want to throw the baby out with the bathwater. There are many people that have taken opioids safely, without problems with addiction, who are highly functional, who are working, participating in their lives, and that's not necessarily a bad thing, but a lot of people aren't, and they're finding that the best they can do is get out of bed and stay around the couch, and opioids they feel like are their last option.
A crutch for them. It's like they become dependent on it.
I don't know if a crutch is the right way, but when you have chronic pain and you feel like nothing else has worked, and opioids are considered to be the strongest thing, that's what you'll take. And it's very scary to have somebody come in and say, I'm just going to take your opioids away from you, if you don't provide evidence-based alternatives for people who are still suffering with chronic pain.
Okay, and that's at the heart of your TED Talks, right?
Yes, so I just...
Now hold on, we're going to get into that. I want to get into that because, I mean, and the TED Talks, by the way, people can see these as well. Are they on YouTube?
Yes, it's on YouTube, and mine is called The Hardest Pill to Swallow.
Okay, I want to talk, we're going to get into that, and exactly that, what we just segued to is how you find the alternatives, correct, for people. Because otherwise, it is scary.
Yeah, it's
on your own, deciding to come off it, thinking you're all of a sudden going to be faced with this pain again.
Absolutely, and the interesting thing is that it's very hard to do it on your own.
Right.
And so I would, although opioid withdrawal is not typically life-threatening, I really would recommend discussing it with your healthcare provider before you would do that.
Sure.
That being said, the vast majority of people that I've seen who've been on opioids for long times and decide to come off find that their pain is no different. It may, and it's oftentimes significantly better.
Right.
But that's very hard to believe
I
when
know,
you feel like opioids have been the end of the road option for you. And so what we need to do better about in the medical community, what the insurers and everyone need to do better, is providing alternatives to opioids that have been shown in our literature to be even more effective.
Excellent. All right, we'll get into all of that. We're going to take a break. When we come back, if you want to join in the conversation, the number is 737-7587. Sometimes it's intimidating to call in and talk to a doctor, but she's nice. It's not bad. But either way, I know many of you may also want to just listen and absorb the information. We'll be back with more on those alternatives and your calls if you'd like to join us right after this. Stay with us.